Hello, everyone. My name is Jen Braun, and I direct the AHA Team Training Program. Welcome to our final webinar in our three-part webinar series that focuses on human-centered design thinking. This webinar will focus on how to craft your narrative or your story by using human-centered design. And if you did not attend either the first or the second webinar as part of the series, that's totally okay. You can certainly go back to that and check out the recordings, but you should still be able to follow along here today. We have our speakers from Do Tank back again. So before I hand it off to them, I'm just going to go over some rules of engagement and announcements. So you can access audio by listening in through your computer speakers or through your phone. If you're having issues, you should be able to access the toolbar at the bottom to switch to either phone audio or computer audio. And please note that you are in a listen-only mode. And so all hyperlinks that you'll see here shortly on the screen are live. So keep that in mind. You can click on them. Finally, I will moderate a Q&A session at the end if we have time with our speakers. So if you have questions, please chat them in throughout the presentation. If it's technical or logistical, we'll answer it in real time. But if it's for our speakers, we will certainly save that for the end, or they might even be able to kind of answer it as they go throughout this session today. We're really happy to offer free CE credits for our webinars. And in order to claim your CE credit, you must create a Duke OneLink account. This is a one-time only setup, and my colleague Kara will be chatting in those instructions. You can also refer to the email that was sent to you today with the attachment that also has the same instructions. And then following today's webinar, please text the code BAGWOY to the number you see there. You'll have to do it at the end of the webinar, and we will certainly share this code again at the end. So don't worry if you aren't able to write it down right now. In terms of upcoming events, we have a full slate of education lined up for the first half of the year. As I mentioned in our previous webinars, AHA Team Training has made enhancements to the in-person TeamSTEPPS Master Training course curriculum to include human-centered design exercises that our partners here at Do Tank helped us create. So if you've enjoyed the last few webinars or this one today, it will give you a really good indication of what to expect during one of our TeamSTEPPS Master Training courses. And just know the TeamSTEPPS tools remain the same, but our updated course will provide participants with more time to collaborate with the teams that they came with, in addition to really walking away with both a strategic and a tactical game plan for how to implement TeamSTEPPS back at your organization. So registration is now open for all these courses you see here. Please keep in mind that attending in teams is highly, highly, highly encouraged, and we have team discounts, so check out the course webpage for more details. If you want to become a TeamSTEPPS Master Trainer and aren't able to go in person, we have a virtual course that spans 8 weeks and kicks off in April. And so the format of the course is that each week there's asynchronous or on-demand learning that's usually about 30 to 60 minutes. And then the class meets live over a Zoom session on Thursdays to really discuss and practice and apply what was learned during that on-demand portion. So registration is also open, and like the in-person course, we highly encourage attending with a team. Finally, if you're looking for a more customized training solution, we offer on-site trainings where we come to your organization to deliver anything from a 2-day TeamSTEPPS Master Training course to a more comprehensive training program that can span multiple on-site trainings and visits and virtual coaching to really truly support your TeamSTEPPS implementation efforts to help foster that ownership and sustainability at your organization. So if you have any questions, feel free to chat us about that, or you can learn more about your options, and we can certainly schedule one-on-ones and explain more over a call if that's what you're interested in. Finally, in terms of our webinars, we have a very exciting bonus webinar coming up next week about creating a value proposition for TeamSTEPPS, how your front line and your bottom line can both win. I love that title. So my colleague, Rhonda Fisher, who is our AHA Team Training Clinical Program Lead, and I will actually be presenting. And this will be a really great webinar to attend if you're looking for data and a value proposition as to why to bring TeamSTEPPS to your organization. In addition to that one, we have another bonus webinar from our partners at the Physicians Committee for Responsible Medicine, who will be presenting a case study about hospitalization as a teachable moment using plant-based options on patient trays. So definitely a unique topic, but we'll focus on how they've implemented this from a team approach. So registration for both these webinars are free and open. So encourage you to check that out as well. So that's enough of me. Let's get to the good stuff. I'd like to introduce Adam from DoTank, who presented on our previous 2 webinars. And a new face to the group here is Alex, who is also from DoTank, who'll be presenting today as well. So guys, I'll turn it over to you.
Oh, thanks so much, Jen. Appreciate it. And excited to be here for the 3rd and last leg of our webinar series. And as Jen said, what we've enjoyed so much with this group is being able to share the different ways that we're applying human-centered design into healthcare. And as she stated too, if you weren't a part of those first 2 webinars, it's totally fine. This is like a standalone session that we hope you're going to get some value out of, but would definitely encourage you to take a look at the other 2 recorded webinars if you've missed out, because there's a lot of good stuff in there. My colleague, Alex Spiroff, is a human-centered designer with our team, and she's going to be joining me in this discussion. We're going to kind of go back and forth with our slides and our discussion points, and I'll wait till our deck gets back up. And sorry, 2 seconds. There we go. So what we've done in the first couple of webinars with this group is I feel like we've gone a mile wide and an inch deep. We've given you guys so much things to think about, and Matt and I were talking at a fervent pace so we could throw out all these vignettes and then not get too in depth with them. But today's strategy is a little different. We're going to go like a foot wide, and we're just going to focus on storytelling and pitch and narrative, and we're going to go really deep into that one topic. Again, hoping that today is going to be filled with some practical and pragmatic points and tools that y'all can use when you're having discussions with colleagues and trying to sell a pitch or an idea or a project that you want to do, or if you need to go in front of your board or in front of a committee or outside stakeholders and convince them of the work that you're trying to do. So this stuff really applies across that continuum. So with that said, we have told stories a lot to you guys in the 3 hours that we've been together throughout this cohort and this webinar series. And I think what's interesting that you might find today is that with all those stories that Matt and I told you, even though there's a very diverse array of topics on the screen here, we've taken this same approach and this same narrative approach to how we've built out a story, because story is actually a lot more than just a pitch or a story. It's strategy, and I'll talk about that a little bit more as we go on. But it's a part of all of the work that we do at DoTank. And today we've got a pretty straightforward agenda for you that is going to walk us through how we can help you guys tell your own stories. So I'm going to set the scene here. I'll talk about some high-level concepts before we start deconstructing what we mean by storytelling. But very simply, we just cut that word in two, and we focus first on structure, principles, crafting, the what, and then the telling part, the how. So how we're going to be communicating those stories, what the key stakeholders are, and how we're going to deploy our messaging. And then we've got a couple examples that we want to show you. One that's outside of the healthcare realm, that's a very effective service that probably 80 or 90% of us on the line have used before. And then we're going to give you all the chance to test a tool that we use in storytelling a lot as well. So that's going to be this document here. So when the time is right, as the webinar progresses, we're going to drop this in the chat. And we're not going to seek to complete this whole document, but what we're going to seek to do is kind of drill down into each of these buckets and explain our theory and methodology, so that by the end of this 60 minutes, you'd be able to pick up this tool and effectively know what it is and use it as a resource to help you craft your pitch or your story. So that's the fun stuff we're going to get to today. Like I said, we're going to be fast-paced, hopefully not as fast. I'm even like mentally trying to slow my speech because I felt like Matt and I were going a mile a minute. So we are going to be fast-paced. You're not going to complete that whole form, but we want to ensure that we have time for some discussion here at the end too. So feel free to pitch those questions or comments in the chat. Alex and I might jump on them in real time, or we might save them for a discussion point if it's a point we'd like to illuminate with the group. And what I'm also hoping too with that time, I know we'd promised in the past, we didn't have quite enough time to dig into some of those topics that y'all had interest in. So there may even be time to discuss anything from webinars 1 or 2. So with that said, let's go ahead and jump into the framing and the setting the scene of what we mean by storytelling. So I really like this quote a lot, because what Ben is laying out here in this next slide is the importance of storytelling and how it is a lot more than just marketing or fluff. Some people think that storytelling, when I talk about it, I definitely have friends of mine who I'm like, oh, I'm doing a storytelling workshop today. And they're like, what do you do? What does that mean? And to especially the more that you are engaging with executives and teams and decision makers who have budgets and purpose, it's really strategy. And so I think if you all will join us in this mindset as we progress through these slides, and saying that telling a story isn't just convincing someone of a point of view and trying to be correct and get them to be in your tribe, but really, if you think of your PowerPoints and all the stories you're going to tell being rooted in that strategy, and the better your story is, the better your strategy is going to be, the more buy-in you're going to get, the more you're going to be able to empower people, the bigger impact you're going to be able to make with your job. If you embrace storytelling with those lenses and that mindset, it's going to get you a lot further. So let's talk about some critical elements within storytelling and what the job to be done is. And I feel like these top 3 apply to every story that you're telling, to every group, whether that is pitching this to an internal colleague that maybe you want to get them engaged in a project that you're doing. Maybe there's an outside stakeholder that you're trying to get funding to enact. Maybe there's an internal stakeholder from on high that you're trying to convince of something. Whoever that is, at the end of the day, you're trying to convince somebody of a point of view. And what you want to do is build trust with that individual and make that conversation and that story as simple as it can be. And often in healthcare, that's tough for us, because the problems that we're dealing with, the data that's in front of us, the clinical outcomes that are in front of us, things like health and racial equity, those are not simple issues. Those are very complex conversations. But the more that you can box that out and simplify it, the stronger your strategy is going to be, and the farther that story is going to take you. So the bottom of the slide here has a few different examples. A lot of the times folks are trying to pitch to secure more resources or buy-in for a project, or you're trying to educate. Maybe it's a new EHR, maybe it's a new program that's coming up, but you have some education didactic job to be done. And oftentimes it's to align folks. So we're going to get into our storytelling principles here and kind of show you how we just deconstruct the word in a very simple way. So on the left-hand side, the first thing that I'll tee up to you and we'll talk about is the important stuff within your pitch or within your story. So that content and that alignment, how does your content that you're going to be deploying align with the audience that you're talking to? That is a critical point that I think a lot of folks sometimes get too mired in their story or their PowerPoint or their data and their perspective, and they don't take a step back and think about the audience and how different sets of lenses around the table might react to your story or your project. And so ensuring that we're thinking of our content and aligning that up front with our stakeholders and having that kind of empathy lens is big. So I'll talk about that first, and then we'll get into the telling part. So the deploying part of that equation. And that's thinking through the different channels or the different ways you can tell a story and how your plan of telling that story should be constructed. Because when you have that plan in place, and for me, this has been really an illuminating concept that I'll show you here in a couple slides that I've applied to kind of every PowerPoint and even emails or any pitches that we're doing. So we'll get into the fun stuff here. So I think we've got our pretty slide here. We're going to talk about the first side of that equation, which is the story. And now this next slide is the piece that for me, if you have like, what's your key takeaway message or your take home message for the next 60 minutes, if there's a concept or a slide that you're going to remember, for me, it's this one. And this is the one that stuck with me the first time that I was kind of exposed to this methodology. And it's very simple. It's basic. It's saying that every time you're telling a story, let's ensure that you are speaking to folks' head, their heart, and their eyes. So even if it's a 3 PowerPoint deck, or if you've got a pitch that you've got to give that's going to be 30 minutes of convincing a whole bunch of stakeholders, regardless of how verbose or not that pitch is, you should always frame in your head that you want to be speaking to the head, the heart, and the eyes. So let me drill into each of those for just a second. So what is the head? So the head is our strategy. I feel like we're really strong in this in healthcare. We're pretty good with talking about ROI, harms prevented, lives saved, costs saved. We've got pretty robust analytics at a lot of our fingertips, or at least the ability to pull data out and have that be a part of our story. So a lot of times, especially with clinicians, who have some of the driest PowerPoints on earth, they've got all the black and white and they've got the brain in there for sure. They've got the strategy. But if they don't have kind of the heart or the eyes, it's tougher to tell that story. So I think we've done a pretty good job in healthcare of addressing the brain and the strategy and the data and the ROI and all of that kind of more concrete black and white stuff. But where I think we have more opportunity is to tell the story of the heart, because I think these pictures and the stuff that y'all do on a daily basis with patients, it's altruistic. There's an altruistic calling in nature to the work that we do in healthcare that goes on a day-to-day basis, but rarely is told effectively or in the right way. So this is an interesting one to me, where I feel like the heart is in so much of what we do and of what you all do and of what so many of your pitches mean. But do we do a good job of articulating that story when we're pitching it to folks? So do we call out at the beginning of maybe a presentation an actual patient or someone who has been affected by the thing that you're pitching, and really personalize that and speak to the heart, give people a name, give them a face. And as that story progresses, by the end of it, pull at people's heartstrings and have them thinking about that individual that you're keying in on as you tell your story. So we do a great job in practice of this, but I think there's a lot of opportunity on how we can more effectively integrate the heart into our pitches and our stories in healthcare. And then the third element is the eyes. This is one where I think we do a poor job of. A lot of slide decks I see are not very visually appealing. There seems to be a camp of some folks who just have bullet points and a lot of copy and words, and other folks who just put up a graph and don't have any context and just talk at a graph for 30 minutes. And so I think visually we've got a lot of areas for opportunity to make our slide decks, our pitches, our stories more appealing. And again, not just appealing visually, but effective. Because if storytelling is strategy, then we want to present things in a visual way that folks are going to capture, believe, and want to be a part of. And if you do that effectively through a PowerPoint, and get you a lot farther than just black and white words on the page. So that's when we have some opportunity in all three of these areas. Alex is going to dive down a little bit deeper later and show some tricks and tips. And we're going to talk about each of these elements a little bit more. But again, that's kind of a high level concept that we wanted y'all to keep in mind: head, heart, and eyes. So those are the most important elements for us of a story. So once we have that in place, and you have that mindset, and we're thinking about head, heart, and eyes, we need to be, it's helpful when we standardize anything, right? Whether it's a CAUTI checklist or how we tell a story. And so what we've kind of attempted to do is create a little checklist to reduce CAUTI, to reduce falls, to reduce readmissions. We've done that for storytelling. And so that structure is important to us. And so the next slide, I'm going to show you kind of some elements of a classic pitch. And so we've kept these in mind as we've created the template that we have for storytelling. First and foremost is always, setting that scene, giving folks context. Within that scene setting, also thinking about the head, heart, and eyes. Like to me, when I'm talking about a pitch or a story that I want to tell a group, the first slide is important because I want all three of those things to happen. I want to set the scene and make it clear why we're here today, where we're trying to get, but I also want there to be visual elements that are warm or embracing. And I also want to try and integrate the heart early on when you set that scene. So whether it's an individual or a patient population or some group, let's ground them out of the gate when we set the scene and wrap some purpose around what it is we're asking for or what it is we're working towards. After we set that scene properly, it's all about the problem and the challenge. And so, my background is quality improvement and patient safety. And so for me here, it goes to like, what is our aim statement? What is that thing that we're saying? Here's the population we want to change. Here's the time that we're going to do it in. Here's the responsible parties. And then here's how we're going to do it. So framing that very clearly in an unambiguous fashion, that's very explicit. It's not implicit. It's not something that 10 minutes into your presentation, somebody might be sitting there and saying, why are we here? What are we talking about? So out of the gate, let's set that scene, get people engaged, and then be really clear and crisp with our problem and our challenge. That third element is then in ensuring that your value proposition is customer-centric or patient-centric. So we'll get into this a little bit more when we get into the detail of how we kind of approach this through our standardized one-pager, but this is a big piece of it, empathy and value proposition. And so a lot of this third part is like your homework. So this is the stuff that you got to do building up to that pitch, building up to that project or that presentation, is ensuring that you've done kind of the proper legwork of getting opinions outside of your own, looking at data from different angles, and ensuring that your value proposition is going to be there. So as we progress, we obviously want to talk to folks about how the thing works, right? And Alex and I have a really cool example, again, that is not in healthcare, but that is so simple that many of us have used. And I think sometimes in healthcare, the projects or the problems that we're trying to tackle, since they're so complex, it's hard to tell that story of how they work in a simple fashion. So this is one that can be a challenge, but one that's critical. And speaking of critical, the next thing that we want to do too, when we're telling a story or talking with groups or making a pitch, is being open and vulnerable and transparent about assumptions that you might be making. That can go such a long way whenever you're trying to convince another party or a group of stakeholders of something. And I think this is one that for me is often most skipped in pitches that I see with folks, because it's one thing, I think people get maybe a little too mired in the project and what you're trying to sell, and you're not upfront about saying, here's the vulnerabilities, here's some assumptions that maybe we have that I'd like to solve for, or that we need to be mindful of if we're going to move forward with this work or with impacting this vulnerable community or whoever it is. Like, there's some assumptions in place, like my story and what I'm telling you right now is not the silver bullet. Basically being humble, I think is what we're getting at here with critical assumptions. And it's one that we could, I think as an industry use there's an area of opportunity there for sure. And so, 6 and 7 are really key. Just proposing your next steps, being really crisp and clear with that pitch. So again, when folks get to the end of the presentation or the pitch, they know exactly what is being put in front of them and what's being asked. And there's not ambiguity around what the next step should be. So that's one where it varies. We've seen, this is one where I feel it's like about a 50% rate where some folks are just really good at this and they're really nice at crisply saying, okay, so given all that information I've shared, here's what we want to do next, and here's what my ask is. And then other folks sometimes aren't innately they don't go there, and so they're a little softer with it. But I think it's critical to have 6 and 7 kind of rooted there. So those are just some classic pitch elements that we have kept in mind when we've created this leaner version of this document that we're going to give you guys access to in just a little bit. So I'm going to tell the second side of the story here, or the second side of storytelling, and then I'm going to kick it over to Alex for a little bit. But this piece is all around what you should keep in mind and what you should be intentional about when you're executing that story. So you might have the story in mind and what you want to tell, but this is that homework piece that I was talking about with critical assumptions. So being open about who your audience is, the with them, the what's in it for them, what are they going to be thinking, what do we want them to do after I talk to them, what's that decision point, being really explicit with that. After this pitch or after this story I'm going to tell this group, do I want like funding? Is it a funding request? Is it another meeting with a different stakeholder? Like really thinking through exactly in your mind what's ideal as a next step after I have this group for 30 or 60 minutes, and baking that into your story, being intentional about that is critical. And then in what is that all in service to? So audience and empathy are again, two things that we've talked about I think in every discussion that we've had with this group, and it's ones that we're going to get into a little bit more prescriptively here, and again show you some tools of how you can more effectively tap the mindset of your audience and explore that before you get into your story or your pitch. So stories should always be rooted in that empathy and human understanding. So this is that heart piece, right? And it's also one thing that I think is really effective is in telling that story too, to be a part of your narrative with that heart piece. Is to share with folks that you have, like leading up to this pitch or to this deck that you're presenting. You've talked with colleagues, you've talked with patients, and while this is your perspective on how this should go, you've done your homework with rooting yourself in that human understanding and putting that lens of empathy on. So what I was getting to there is really around that nuance plan. So again, understanding that you're going to have different lenses around every table. And so being open about that out of the gate and saying, what are the different techniques? What are the different messages I should put into this story, knowing that this is going to be received in a very different way? So that's always something we want to be mindful of. I think this next point around your skeptics is a huge one. And this is one too that folks too often are maybe a little hesitant or scared to take. This is one where I think I know that I've mentioned the equity work that we're doing with Commonwealth Fund through this national pilot. And it started in Illinois when I was with the Illinois Health and Hospital Association. And when this work started, I had some skeptics with the Illinois Hospital Association who frankly said, you know, you're naming this thing the Racial Equity and Healthcare Progress Report. Outside of our big urban centers in Illinois, we're a very rural state. And the challenge to me from some folks was, how are our small and rural hospitals and our critical access hospitals and some of these communities who have very homogeneous populations that are maybe 95% white or homogeneous, how are they going to feel when we put a racial equity assessment in front of them? What if they don't feel that they have racial equity needs in their community? It was a big challenge. And so some folks said we're lobbying that our equity work shouldn't have the word racial even attached to it because of that. And so I invited those skeptics to the table, and we challenged ourselves and we talked about it, and we got to a point with our internal team and with our members in which we had a very open conversation around the fact that racial equity is what we are centering on, and it is the critical piece because we have so much data that demonstrates that health outcomes are poor for different minority communities. And while that is the case, even if you're in an organization that might not have that much racial parity, there's still a chance and an opportunity for you to deliver more equitable care. And so there's other things that we're measuring in our equity assessment that aren't tied to race, but that are tied to social determinants of health. They're tied to access and transportation and housing. And so that conversation was really beneficial. And I know I just kind of told a little narrative there, but over the course of weeks and months, we had some really good dialogue with folks who had different opinions about the approach we were taking. And we didn't change the course of where we were going, but we heard our skeptics, we heard our critics, and we also talked to some of our members who had similar mindsets of the folks internally. And at the end of the day, the folks that we invited into that discussion who had a different perspective than us were some of the biggest and still are some of the biggest advocates of this work. So that counterintuitive choice, it's a tough one to make. And it's a tough one sometimes to seek out those who might not agree with what you're doing or who may simply just have a different point of view, but their feedback can be so critical in getting to the place where you want to go. So invite those folks to the table early and often. Testing your story again too. So this is one, if you've got like a colleague, I feel like, Alex, you're my work sister. You're the person I can go to if I am putting together something that I want to sell to internal people or to external people, or something I feel passionate about that I want to happen. Find those advocates that are your peers and your colleagues that you could sit there and say, hey, can I steal 15 minutes of your time? I just want to tee this idea up and I want you to poke holes in it. I want you to give me some feedback. That can generate excitement. It always is going to make your pitch better. The more you practice your pitch with other people, the better it's going to be. And not just your pitch, but the better, again, your strategy is going to be. So if you sit here in front of your slide deck by yourself for an hour, practicing, it might come out just how you want it to, but it's going to be richer the more you test it. So again, touching on these concepts, those were just some high-level thoughts and principles that I wanted to share before we get into some of the more nitty-gritty tools. And so with that said, the point is to influence change. And so we're hoping to give you all some thoughts that might help you influence your change a little bit more effectively, and some tools to do that as well. So with that, Alex, let me kick it to you so you can share with us a couple of those human-centered design tools that are effective in building a good pitch or a good story.
Yeah, thanks, Adam. So excited to introduce some tools. There's already been some chat in the chat about where we find the tools. And so I'm happy to hear that you guys are really excited to use these. So we're going to introduce two today that we feel like are really helpful, kind of prerequisites to building your story and building your pitch. So let's start with the empathy mapping canvas first. So this is a great canvas to use to understand your audience, whether that's who you're creating a service for or the person that you're going to be pitching to, right? Maybe I'm creating a service for type 1 diabetics experiencing burnout, right? I can go through and understand what they're going through and what are the things that I would need to appeal to about them. Or if I'm thinking about, all right, I'm going to pitch to my CFO today. I need to understand what he's thinking, what he's hearing, what he, is looking for, or she, sorry, gendered. But let's talk through the empathy map a little bit. So we have the person in the center, their internal thoughts and feelings, and then what is happening in their environment. So as we go through, you first identify who is your stakeholder, who is the person that you're identifying with. What do they need to do? What is their job to be done? What are their main tasks and objectives? What do they see? What are the things that are in their environment that they're observing? What are they seeing in the marketplace? What's in that immediate environment? What do they say? Maybe this is a great place to say, I've heard, so-and-so talk about this. I've heard them say this direct quote. What are things that they're saying and verbalizing? What are they doing? What are their actions that they're seeing? What are we observing them do? And then what do they hear? What are things that they're hearing from others? What are things that they're hearing in their environment, hearing secondhand? What is that kind of external environment in which they're existing? And then internally, what are their pains, their fears, their frustrations, their anxieties, things that they're dealing with, going through? And then what are gains? So what are things that are their wants, their needs, their hopes, their dreams? What are things that they want? And then what are other thoughts and feelings that might motivate their behavior? So if we take you through an example here, I went through and did the type 1 diabetic patient experiencing burnout, right? If I'm creating a service for them, I want to have a really deep understanding of what they might be experiencing in their environment and what they might be internally feeling, and use that to build my pitch, my story, around how I'm going to address some of these pains, meet some of these gains, and be a part of this environment that they're existing within. So maybe their job to be done is that they need to lower their A1C. They're seeing endless alerts. Other diabetics aren't really struggling. They're feeling very frustrated. They're expressing that they're frustrating. They're not doing some of these behaviors that we'd like them to be doing. And then they're hearing from other people that they're worried about them, or they're feeling judgment. They're hearing judgmental statements, and they're feeling this internal pain, frustration, and anxiety, feeling like they've failed. We really want to be feeling supported, understood, and then also feeling fear, burnout, and shame, right? So how can we go through, use this exercise to create our pitch based on this understanding once we've gone through this empathy map? So that's a great tool to use in a couple of different scenarios. Another great one is an idea flip. So I think of this one as a great way, if you've already done the work, to use this as a template to your pitch. This is also a great canvas to use when you're just in the initial ideation stage and starting to flesh out what you want to talk about a little bit more. So going through this one, we have the problem, the big idea. So what is that problem that you're going to be solving? What is that big idea? You have to solve it. What's any detail that you can add behind that? What is the impact that that idea might possibly have? What is that size of prize, the ROI, the CFO section, right? And then what are some of those assumptions and risks that are still outstanding? Like Adam talked about, that's a big thing that we always want to make sure that we're not glossing over. What are things that you're assuming? What are risks that are still present? So we have a great example here about nurse staffing. Experienced nurses are leaving the workforce. Major problem we can all identify with this. If the big idea here is virtual nursing, there's some background on this. What is some detail behind that? And then what's the potential impact? Increasing patient safety, greater nurse well-being, higher production competency, that potential size of prize, decreased cost of care, decrease in staff turnover, right? Those are attractive things. And then what are the assumptions and risks? Is the tech reliable enough to do this? What is the liability? Do we have admin and staff buy-in? So this is a great way to go through if you've already been thinking about this virtual nursing and thinking about having some kind of platform like this. This is a great way to go through and just kind of organize your thoughts around this. What is that problem? What is that big idea? What is the impact, size of prize, and assumptions and risks? Adam, anything else to add in here about how we use these kind of canvases when it comes to storytelling?
No, the only thing that I would say is keep these two concepts in mind that Alex just teed up with empathy and the idea flip as we share with you the document that you're going to work through. Because what we tried to do is to take a couple of these concepts and integrate them more fully into the story design one pager that we have. So even if you don't go through the rigor of getting an empathy map and sitting down with somebody or doing the idea flip, we're trying to take these two thought processes and integrate them into how you design your pitch and your story. So these are critical elements, and this is kind of the master tools, if you will, if you want to dive deep into integrating these concepts. But you got to do it. We got to vet the ideas, and we got to get more perspectives than just our heads whenever we're putting a pitch together.
Yeah. All right, so let's check out an example, as Adam's alluded to a bit. We're going to talk about something that most of us have experience with. I'm going to show you as part of Uber's original pitch. The original pitch that Uber did was very, very ugly. And so someone has gone through and redesigned that a bit. I'm going to be pulling a couple slides and using this to talk through some of this kind of big structure that we're talking about. The problem, the impact, key assumptions and risks, this structure that we have for you on this PDF that we're going to be sharing here in a bit. I'm also going to be critiquing this pitch a little bit because I think it does some things really well. And I think there's some things that are, less, that leaves to be desired. So let's get into this one as an example. So they start by framing their problem, right? Problem is cabs in 2008, using aging, inefficient technology, hailing done by hand or phone, and then also the problem in the taxi industry in terms of the medallions being required to drive a taxi, the cost of those, and then what that means for consumers when they're trying to hail taxis. Their big idea, obviously, we all know, is Uber, initially called Uber Cab. And so they lay out here their solution, fast, efficient, on-demand car service, and give a high level bullet point details about this. Then they get into the how it works. So this is really here, they're addressing the three big pain points. And this is where I think there's not a ton of heart in this, right? Because when they say you have to be a member to use the service, you're not hailing from the street, and there's guaranteed pickup. What they're saying there is they're addressing three big pains that were in around hailing a taxi, right? You're getting into a car with somebody, there's no digital footprint of who you're getting in that car with. Maybe that's not always the safest. So that is something that having a membership service, seeing who's picking you up, seeing their picture, that's something that's helping there. Not hailing from the street, you're able to call at whatever time. You're able to call from whatever location. You don't have to go to the most major road, right? That was another pain point with taxis. And then guaranteed pickup, not having to fight for the two taxis left at the end of the night, or wait an hour for another one to drive by you. You get guaranteed pickup to the spot where you are, right? So they're explaining this how it works, but not really giving a lot of that heart or saying why that is something that people really need and why that's fixing a pain. But then they're giving the key differentiators. What are these different things that are going to be there, and some imagery behind that to kind of demonstrate what those services are. And then also showing how it works in terms of what is their technology, what is the technology that's going to be supporting that, looking at that app and seeing that, okay, I have this on my smartphone, everyone carries smartphones in our pocket. How is that a tool that we can use to revolutionize this service? Then getting into the impact, right? So there's some of the use cases where Uber can come in and disrupt some of these things like airport pickup and drop off that totally changed the game. Also getting into some of those user benefits. So that's an impact too. What are the benefits to the users? And then what is that market size? What is that potential impact in terms of ROI? And then at the end, they talk about future optimization. So that's in the key takeaways, what we would define as key takeaways, or what are some of the things that they like to do in the future? What are some of those next steps? So we think that that's a pretty good idea. You can also see through this, it's colorful. They use a lot of iconography. They use not a lot of text here, just get the main points, but you can go through and get the gist of what they're trying to say. Obviously, there's a lot more detail behind this, but if you go through this pitch, you understand what the product is, how it's going to help, how it's going to work, and then what are things that they'd like to do in the future. What are some of those big takeaways? All right, and we can kick that back to Adam.
Awesome. Thank you, Alex. So before we transition into the next section, I want to address, because there's a couple questions about the empathy map, and I put a rather verbose narrative in the chat to try and tee that up. But one example that comes to mind that I'll share, I just did some work with a large health system who was focused on burnout and workforce. And I was lucky enough to have, they had a retreat with about 50 nurses. And so what we did was, there's a whole strategy going in place with this health system around what they're trying to do on the workforce front. I said, you know what, why don't we ask the folks who are at the front and middle lines what they think first before we start jumping to solution modes and throwing ideas out there. And so it was really illuminated over the course of an hour. We had 12 tables with about 8 to 10 nurses at every table, and we just simply slapped an empathy map in front of them. And the amount of data that team collected, because every post-it note is a data point, was enormous. And we're still looking through and trying to call out those key themes. But that health system learned more in an hour with one empathy map at a table than they would through doing a bunch of surveying or focus grouping. And so that's one really effective way to use the empathy map, and to do that before you're getting a sense of who you're, like when you know who your audience is that you're going to pitch to. If you have the ability to do that it's ideal. The other way to use that empathy map is to kind of craft what you think the pains and gains and what folks might be thinking and hearing are, and then put it in front of them and say, hey, we're working on burnout. And from our perspective, this is what we think where the nurses' heads are at. And so we want to craft our pitch and our project with these assumptions. And folks might say, yeah, you're right here, but you're wrong here. So use it as a tool to get sourced data from the client or the patient, or use it as a validation tool. Fill it out yourselves. And then, but what isn't lost in either of those equations is getting the person's perspective one way or the other, either to validate what you think or just to tell you where they're at and what they think. So I hope that is helpful. So with this, we've got about 14 minutes left, and we've got a couple more sections. So the first and foremost thing that I'm going to do is I'll share a document in the chat. And so we want to shift from that Uber kind of product centric example that Alex just went through to one that we think is more aligned with all of you. When you're pitching, when you're telling stories, it's and it's about your communities, your colleagues, leadership. So the next slide here is going to tee up the document that I just shared. It's really simple. This designing your story document simply takes those three elements that we said about the head, heart, and eyes, and you can see their icons on the left. And then we work you through what we think are those critical elements of the pitch. So first, kind of stating your problem, what your big idea is, what that impact would be, and then your pains and gains. So on this slide here, the first thing we're going to do with this deck is that you want to plug in your title or whatever it is that this presentation is and who your audience is. And then this is where, like I mentioned a couple of minutes ago, we're taking some of that empathy map theory and integrated it into here. So this would be something that you would fill out, what you think the pains and gains of your audience are. And this is where it'd be ideal. You got to have some validation here. So jot down your pains and gains, little bullet points. Do that before you even start to craft your pitch, but this is a good chance for you to start getting in the mind of your audience or your customer. So after you've done that, the next thing is just to cycle through the problem. And so for each of these, again, for each of these four areas, we're just going to challenge you with this document to jot down the head, the heart, and the eyes. And so, for example, let's say it's a project that's focused on readmissions, 30-day all-cause readmissions. So that's a problem that is a clinical issue for many organizations, and it's very kind of sterile and straightforward in a certain sense from a data perspective. So the brain part will be really easy to put metrics in front of people and explain why we need to reduce readmissions and make care coordination better. Probably would be good if we could key in on a patient and have a heart story there for readmissions out of the gate. And we key on Mrs. Jones, who lives alone and who doesn't have transportation or housing or loved ones. She might have a lot of SDOH challenges. Get a patient story that you can connect to that clinical piece and kind of carry you through. And then from an eyes perspective, ensuring that maybe you're doing a little bit more than just showing 30-day all-cause readmissions charts that are all going up and saying, hey, we got to change this. Think through. Maybe it's some pictures illuminating those different social determinants of health that patients deal with on a daily basis, whether that be transportation or food insecurity or homelessness. Use some visuals to really tie that head heart together. So that's an example of how you want to think through this. And I'm not going to go through all those examples for the sake of time for each of these buckets, but for something like that, care coordination or readmissions, that's how I challenge you to think through each of these buckets. And the same thing with your big idea, your impact, and then kind of your key takeaways and advice. So at the end of the day, and there's an example here from an oncology group that we've worked with who's doing a lot of really interesting stuff and testing. And for them, this was helpful because they were rethinking how to do assessments and treatments. And it was very kind of sterile from a data perspective and from a clinical perspective, what they were trying to do. And so we really tried to push them on these middle buckets of, especially the middle one of the heart. So, you know, at the end of the day, why do we want this process to be changed? And how can we illuminate that better for our audience and for the funders who, if they fund this project, people are going to be better because of it. So with that said, given that we're kind of rolling into the last 9 or 10 minutes here, I want to tee Alex up for some kind of closing tips and tricks, and then we'll have some time to have discussion with the group. So Alex, I'll go ahead and kick it back to you.
Yeah, so a couple tips. This is a quote that we've heard a lot, usually talking about fashion, but before you leave the house, look in the mirror and take one thing off. That applies to storytelling as well. It's often so tempting when you have all of the information, you've done all the work to put all of that information into your story, but what can you think about in terms of what is the MVP of that story? What is the minimum that you can share? How can you make that simple? And how can you maybe take away some of that information without losing some of the content of that story, without overwhelming your audience? Pay attention to pace, pick spots to slow down, raise the volume, think about how you can present in a dynamic way. Make your audience feel like an insider, relate to things that they know. I harp on this one massively. I was in a room full of people who were clinicians serving people with type 2 diabetes, and someone got up and did their presentation, and the first 15 minutes were on the potential complications of type 2 diabetes, right? Everyone in that room knew that, and I watched every single person in that room just kind of go to sleep because they were talking about things that they already knew, and they weren't being like made to feel like an insider. So if there's a shared common understanding of the group that you're presenting to, touch on it, but don't linger on it. Please, 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 please do not do this, right? There's nothing worse than a wall of text. It's really, really boring to listen to people just read a slide of text, and it's not great storytelling. So think about how you, of course, incorporate the eyes piece. And how you can less is more in terms of those things. Data and numbers, thinking back to the head, include data and numbers, even back of the napkin stuff whenever you can. That's really helpful to kind of get a sense and incorporate pieces of that head, heart, and eyes. Again, back to the visuals, Google image search is a great resource. You want to look for large file sizes. You don't want any kind of pixelated images in there, so transparent backgrounds for logos as well. There's also lots of places where you can find libraries of basic relevant icons, and that's a great way to incorporate some imagery into your presentations. Noun Project is one that we use a lot, and that's a great resource for that. So that is the end of our tips and tricks. If you want to learn more or discuss, you can always reach out to us, alex.spiroff@dotankdo.com and adam.colris@dotankdo.com.
Thanks, guys. I know we hit a lot today, but I think this was, like Adam said at the beginning, a really kind of like a deeper dive on a more specific topic. So hopefully those that attended today are really able to take some of what they learned. I know we have actually, when we are starting to think about our presentation for next week on the, the value proposition for TeamSTEPPS. So really timely, really helpful. We just have a couple of minutes, but I wanted to ask one question that Christy had chatted into the hosts and panelists. So when you think about like the basic pitch structure that you guys shared on one of your slides, how do you feel, or what are your thoughts on putting that like request or recommendation or the ask up front? And then kind of stepping into setting the stage and then kind of ending on that, because oftentimes we hear that our kind of get to the point healthcare leaders want to know what the ask is up front. So just wanted to get your feedback there.
Yeah, I'll take a stab, and then Alex, let me know if you differ, but I think it's a lovely question. And I don't think that those 7-step pitch elements, while they are kind of sequential, how I laid them out, I don't think it's like dogmatic, like it has to be that way. And I think that makes a world of sense to put the ask up front, especially this is where just doing that analysis of who your stakeholder groups are, and it might be a CMO that you've got for 15 minutes. It's not like you've got a PowerPoint deck and you've got, you might have to get to the point. So from our perspective, I think that that's totally appropriate. I think the bigger message is ensuring that you have those elements baked into the pitch and that you're thinking through or challenging yourself to, even if it's not a PowerPoint, to have that head, heart, and eyes baked in. So it's a great question. Alex, what do you think?
Yeah, I agree. I think that, it's also about thinking about who your audience is, right? And is that something that, they're going to appreciate the directness, or is that something of like, maybe I need to take them on a little bit more of the journey and kind of wind them up to get there. So, but I think that there's definitely no harm in starting with that and then getting really into the why.
Mm-hmm. Someone asked a question. I'm trying to interpret exactly what they were asking, but so say you're meeting with a new group to brainstorm, but you also kind of want to set the scene. Like
Yeah.
at what point in the pitch process would you kind of give that full pitch? So if you don't have it fully baked, like how might you recommend, I don't know like segmenting it out or kind of teasing it out in chunks? Is that kind
Yeah.
of making sense?
I saw that question from
Yeah.
Kayla. That's a great one too. And here's where my head went with that one, Jen, is what I love about the empathy map is that it is a great icebreaker on its own, especially if you have new groups. We're about to do some work on birth equity in California. And we've been really upfront about the fact that we want to have all these stakeholders at the table and we want to get them in the same room. And the first thing I think we're going to do is have hospitals, CBOs, Black and brown mothers, all the groups in the room doing an empathy map on themselves of just what birth equity means to them, what their pains and gains are. And when people get up and tell your story of what the empathy map means to you or to your tribe or the people at your table, there's going to be like that breaks all the ice that you need to do. If everybody in that room is there for the right reasons, they're going to learn those perspectives of other people. And then, so I love using the empathy map out of the gate with new groups as an icebreaker on its own. And then it's also going to get you a lot of these elements that you're going to need strategically to think about that problem because you're getting a really in-depth view of the other perspectives.
Yeah. I would say it's also never too never too early to start sharing the story. So if you have a concept or you have something that you're just exploring, start trying to craft that into a story, start trying to organize your thoughts about that and use that to share that with people. You don't have to wait until all of this work is complete to share the story of like, this is A to Z what we did. But use storytelling principles all the way through, just as you're sharing your concept, as you're sharing a prototype, as you would a final product.
Yeah, I completely agree. Well, I just want to thank you both for presenting today. Either Alex or Adam, if you could advance 2 slides for me, just for some final reminders for the folks on the line. One more. Yeah.
Oh, I don't have your.
Oh, that's okay. I'm going to share it real quick. Okay. So hopefully everyone see my screen? Okay, so please complete the final evaluation or the evaluation form that will pop up on your screen here once we close out the webinar. Your feedback's really valuable to us. And then kind of the bigger item here is if you'd like to claim continuing education credits for today's webinar, please text the code BAGWOY to the phone number you see here. You have to do that within 24 hours. And again, you have to have a Duke OneLink account. Duke is our CE provider, and they provide continuing education credits for nursing, medicine, pharmacy. So you have to do that one-time only account setup. So just wanted to call that out, but thank you so much, Adam and Alex. Again, you guys have been really great partners of ours. And I know that, Rhonda and myself will take some nuggets from today's webinar in terms of our presentation next week, which would encourage everyone to check out if you want to continue thinking about what your story is for implementing TeamSTEPPS at your organization. We'll have some great data, but we'll also, again, incorporate the the heart and the eyes in as well. So really good reminders for us too. So again, thank you everyone for joining today, and we hope you have a great rest of your day.
Thanks so much, Jen. Thanks, everybody.